So this is our part two discussions about the leg muscles. So Mr. Benji Ababaw, please read the meaning of quadriceps.
What is quadriceps? The quadriceps femoris is a hip flexor and a knee extensor. It consists of four individual muscles, three vastus muscles, and the rectus femoris. They form the main bulk of the thigh and collectively are one of the most powerful muscles in the body. It is located in the anterior compartment of the thigh.
And in addition, and as a matter of fact, quadriceps femoris muscle is a four-headed muscle of the thigh, which almost completely covers the femur. It ranks among its strongest muscles in the human body, which can be split into four muscles. But before that, Mr. Ababa wished to give you a brief discussion about the main function of the muscle. Sir, please, again.
The main function of the muscles. The integrated action of joints, bones, and skeletal muscles produces obvious movements and such as walking and running. Skeletal muscles also produce more subtle movements that result various facial expressions, eye movement, and respiration. Muscles attached to bones or internal organs and blood vessels are responsible for movement. Nearly all movement in the body is the result of muscle contraction.
So after we talk about the meaning of quadriceps and the main function of it, um, Miss Isa, please read the four subcomponents of quadriceps.
Yes, as I was saying a couple of minutes ago, there are four subcomponents being namely rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. As shown in the photo, rectus femoris is part of quadriceps group. It is a bulk of a muscle located in the superior anterior middle compartment of the thigh and is only muscle in the quadriceps group that crosses the hip. Its function are to flex the thigh at the hip joint and to extend the leg at the knee joint. And the vastus lateralis muscle is located in the lateral side of the thigh. This muscle is the largest of the quadriceps, which includes rectus femoris, vastus intermedius, and vastus medialis. Together, the quadriceps act on the knee and hip to promote movement as well as strength and stability. They provide power for and absorb the impact of daily activities such as walking, running, and jumping. Next, while in vastus medialis, it is one of the four muscles that make up the quadriceps group of muscles. It originates from the upper part of the femoral shaft and inserts as a flattened tendon into the quadriceps femoris tendon, which inserts into the upper border of the patella. Together with the other muscles that make up quadriceps femoris, it extends the knee joint and also contributes to correct tracking of the patella. And the fourth, vastus intermedius, is located centrally underneath rectus femoris in the arterial compartment of the thigh, and each side vastus medialis and vastus lateralis respectively. It is one of the four muscles that form the quadriceps femoris muscle. Tensions of vastus Intermedius is a new muscle that is part of quadriceps, which extends the knee joint and stabilizes the patella.
So let's move on to the next topic, which is hamstring, and Miss Charich will explain this.
Hamstring. So, what is hamstrings? Hamstrings is any one of the three posterior thigh muscles in between the hip and the knee. It runs along the back of your thigh. So, let's see the hamstring structure through this chart. So, there are three muscles of hamstrings, which are semitendinosus, semimembros, semimom, semimembranosus, and the bicep femoris. Let us first talk about the semitendinosus. It is a long superficial muscle in the back of the thigh. The origin, it arises from the lower and medial impression of the upper part of the tuberosity of the ischium by a tendon common to it and the long head of the bicep femoris. It also arises from an aponeurosis which connects the adjacent surfaces of the two muscles to the extent of about 7.5 centimeter from their origin. The insertion, this muscle is fusiform and ends a little below the middle of the thigh in a long round tendon which lies along the medial side of the pop- popliteal fossa, the curves around the condyle of the tibia, and passes over the medial collateral ligament of the knee joint. So, uh, the nerve, um, the semitendinosus muscle is innervated by the tibial part of the serratic nerve. So next is the semimembranous. It is the medial of the three hamstring muscle in the thigh. It has a flat tendon of origin that lies posteromedially in the thigh deep to the semitendinous muscle. So the origin, this muscle originates by a thick tendon from the superolateral aspect of the ischial tuberosity. It arises above and medial to the bicep femoris muscle and semitendinosus muscle. The tendon of origin then expands into an aponeurosis which covers the upper part of the anterior surface of the muscle. The insertion, the semimembranosus muscle inserts or the medial condyle of the tibia. This tendon of insertion gives off certain fibrous expansion. One of considerable size, it passes upward laterally to be inserted into the posterior lateral condyle of femur. Second, continued downward to the fascia, which covers the popliteus muscle. The nerve, just like the semitendinosus, the semimembranous muscle is innervated by the tibial part of serratic nerve. Next, next is lastly the bicep femoris. It is a muscle of the thigh located to the posterior, the back. As its name implies, it has two parts, the short and the long head. The long head arises from the lower and inner impression on the posterior part of the tuberosity of the ischium. This is a common tendon origin which the semitendinosus muscle from the lower part of the sacrotuberous ligament. And the other head is the short head. It arises from the lateral lip of the linea aspera between the adductor magnus and vastus lateralis, extending up almost as high as the insertion of the gluteus maximus from the lateral prolongation of the linea aspera within 5 centimeters. The origin, the two muscle heads joins together distally and unite in an intricate fashion. The fibers of the long head form a fusiform belly which passes obliquely downward and lateralward across the sciatic nerve to end on the aponeurosis, which cover the posterior surface of the muscle and receives the fiber of the short head. Inferiorly, the aponeurosis condenses to form a tendon which predominantly inserts onto the lateral side of the head of the fibula. There is a second small insertional attachment by a small tendon slip into the lateral condyle of the tibia. The insertion, as its inster- as, at its insertion, the tendon divides into two portions, which embrace the fibula-collateral ligament of the knee joint. Together, this joining of tendon is commonly referred to as the conjoint tendon of the knee. The nerve, lastly, the nerve in the lower leg that provides sensation over the posterolateral part of the leg and the knee joint.
So next is the criteria in hamstring muscles. The common criteria of any hamstring muscles are: number one, muscle should originate from ischial tuberosity. Number two, muscle should be inserted over the knee joint in the tibia or in the fibula. Number three, muscles will be innervated by the tibial branch of the sciatic nerve. Number four, muscles will participate in flexion of the knee joint and extension of the hip joint.
Overall function. Semitendinosus and semimembranosus extend the hip when the trunk is fixed. They also flex the knee and inwardly rotate the lower leg when the knee is bent. Its functions mainly depend on the initial position of the lower extremity. Similar to semimembranosus, the action of semitendinosus on hip and knee joints mainly depend on the body position. Second, the hamstring crawls and acts upon two joints, the hip and the knee, and as such are termed biarticular muscles. Number three, the long head of the biceps femoris extends the hip as when beginning to walk. Each head of biceps femoris has its own origin and supply, but they share the common insertion. The long head of the biceps femoris arises from the ischial tuberosity and sacrotuberous ligament. The short head arises from the lateral lip of the linea aspera and lateral supracondylar line of femur. Number four, the hamstring play a crucial role in many daily activities such as walking, running, jumping, and controlling some movement in the gluteus. In walking, they are most important as an antagonist to the quadriceps in declaration of knee extension. The hamstring have an important stabilizing function as well. They are inactive when the body weight is equally distributed between both lower limbs a standing position.
So, okay, let's proceed to the calf muscles. If we say calf muscles, it is the back of our lower leg behind our shin bone. It actually includes three muscles. Together, the muscles help you walk, run, jump, stand on your shoes, and flex your foot, or lift your toes up toward your knee. So what is the function or the purpose of the calf muscle? Our calf muscle supports you when you stand and enables you to move your foot and your lower leg. It also propels or pushes you forward when you walk or run. It also allows you to jump, rotate your ankle, flex your foot, and lock your knee. Ma'am, next. So it is made up of two largest muscle. First is the gastrocnemius. It is the most superficial of the muscle. It also has two heads, which is medial and lateral. The lateral head originates from the lateral surface of the lateral femoral condyle. It also medial head. The posteriors are non-articular aspect of the medial femoral condyle. The next is soleus. When we say soleus, it is a wide flat muscle located deep the gastrocnemius. It connects to our tibia and fibula. Ma'am, pa-back nga dun sa picture. Pa-zoom. As you can see, parang mas mas malaki yung gastrocnemius kesa dun sa soleus. And then dun sa pinakang baba niya, kung nakikita nyo, nandyan yung ah, pabalik ulit ma'am dun sa kabila, sa next slide. Plantaris. Yung plantaris, it is a small with an appreciably long tedious portion. Sabi kahapon, konti lang yung nagkakaroon ng ganyang muscle. Parang 10% lang yung nagkakaroon. And then, next ma'am. So what is the structure and function of the calf muscles? The calf muscles are responsible for the plantar flexion in the foot and ankle. What are the conditions and disorder? The conditions that affect the calf muscle include muscle strain, leg cramps, tennis leg compartment syndrome. Next, ma'am. What are the common signs or symptoms of conditions that affecting the calf muscle? First is calf muscle pain, limited mobility, noticeable bulge, tenderness, and to avoid problems with your calf muscles, you should maintain a healthy weight, stay hydrated, stretch and warm up before exercising, watch your medications.
So after we talk about the calf, let's go to the next topic, which is feet. So Mom Juveline, please read the meaning and Mom Beverly will explain it.
The feet. Well-developed feet are important for all dancers, regardless of genre. The muscles in the feet provide stability for all movement and are particularly important for jumping.
So, the muscles of the feet help you while dancing. When a dancer is described as having a strong, supple feet, the topic of conversation is usually point work. But well-developed feet are important for all dancers, regardless of genre. The muscles in the feet provide stability for all movement and are particularly important for jumping. Consistent attention to working through the foot is the best way to ensure that they are able to protect the body and maximize jumps. The 20 plus muscles in the foot help enable movement while also giving the foot its shape. Tulad ng mga daliri sa ating paa, ito ay may flexor at extensor na mga muscles na siyang nagpapalakas sa kanilang paggalaw at may malaking papel ito para sa ating pagbalanse. Next po.
Muscle. The muscular system's main function is to allow movement. When muscles contract, they contributed to gross and fine movement. Gross movement refers to large, coordinate motions and includes dancing, walking, and running. Muscular strength creates speed and force, making for more powerful movement. It is evident through research that dancers are not as strong as they should be to support their flexibility and technique.
Just like what I said a while ago, well-developed feet are important for all dancers regardless of genre. In addition, for the dancers, training foot muscles is as important as developing the rest of the body. Muscular strength provides support to the joints for the dancer so as not to compromise alignment and to increase position stability. This allows the dancer the ability to maintain the position for longer. For dancers to have more control of their movements, specifically when in hypermobile position, muscular strength offers support to the joints, making for safer landings, effortless movement, and decreases the likelihood of soft tissues injuries. Next po.
So flexor digitorum brevis. The main action of flexor digitorum brevis is the flexion of the second to fifth digits at the metatarsophalangeal and proximal interphalangeal joints. This flexes the tool that assists in titling and running. It is in change of the two flexion and at the metatarsophalangeal joints of the lateral four digits. It also supports the longitudinal arc of foot while propelling the body forward during gait.
Okay, so this flexor digitorum brevis, it is a broad muscle found deep in the sole of the foot or no timakon ko na tayo nga dapan tayo, the genopathy muscle. Its precise location is within the sole of the foot directly above the plantar aponeurosis which supports the arc of the foot. For example, nagtiktiklay tayo, this part of our muscle stabilize our movement or posture upang hindi tayo matumba. In summary, the main action of flexor digitorum brevis is the flexion of second to fifth digits at the metatarsophalangeal and proximal interphalangeal joints. Ito yung sinabi ko kanina na articulation sa pagitan ng mga phalanges ng paa. These muscles This muscle supports the longitudinal arc of the foot and stabilizes the foot while walking or running. This type of muscle can stabilize and balance our body in order to prevent us from falling. Yan yung main purpose ng flexor digitorum brevis. Next po. The extensor digitorum brevis. It is located on the top of the foot and the muscle is attached to, to tendons that extend to the toes. The extensor digitorum brevis muscle receives signals from the deep fibular nerve. It controls the movements of all toes except the smallest toe. Pulling your ankle and toes towards you is an example to extend this muscle. This is a thin muscle found on the dorsum of the foot. The most medial tendon of extensor digitorum brevis, or also known as extensor hallucis brevis, extends the great toe at the metatarsophalangeal joint. In conclusion, extensor digitorum brevis works in unison with other muscles to raise the toes off the ground when walking or running. Sa madaling salita, ang bahaging ito ay isa sa mga tumutulong kasama ang ibang muscles upang maigalaw natin o maitaas ang mga paa habang naglalakad o tumatakbo. This extends the phalanges of the four toes into which it is inserted, but in the great toe acts only on the first phalanx. The obliquity of its direction counteracts the oblique movement given to the toes by the long extensor, so that when both muscles act, the toes are evenly extended. Next po. The feet have muscles too. One way to strengthen your feet is to walk on uneven surfaces with flexible soled shoes like Vibram toe shoes, which protect your feet but force those muscles to constantly flex and work to create stability. Next.
Extensor hallucis brevis. It is a thin, broad skeletal muscle located on the top portion of the foot, and it is also essentially the medial part of the extensor digitorium brevis muscles. This digit is the closest to the foot in step, and it is also referred to as the first digit of the foot. The primary function of extensor hallucis brevis is extend the great toes of the metatarsophalangeal joint. It works in unison with other muscles to raise the toes off the ground when walking, running, or even when dancing. The next one is the abductor hallucis. The abductor hallucis muscle is an intrinsic muscle of the foot, a fusiform muscle located superficially and medially in the foot. Following the classification of plantar foot muscle from superficial to deep, abductor hallucis comprises the foot ay the first or the most superficial layer of muscles, along with the flexor digitorum brevis and abductor digiti minor. The function of this muscle is to abduct and flex the great toe. These actions contribute to the stability of the foot during walking by preserving the central position of the great toe and maintaining the medial longitudinal arc of the foot.
So in the last muscles of feet, which is abductor digiti mini or ADM, muscle is on the lateral side of the foot and contributes to the large lateral star eminence of the skull. So the origin of this is arises from the medial and lateral tubercles of the tuberosity of the calcaneus, the plantar aponeurosus, and the intermuscular septa. While the insertion of this muscle, it is tendon and the tendon of the flexor digiti minimi brevis insert together into the lateral side of the base of the proximal phalanx of the fifth or little toe. The action of this is abducts and helps flex the little toe at the metatarsophalangeal joint. This is the support to our feet, so we can move freely and we can walk and run. The clinical is this small two abductor works as a unit with some of the other muscles of the sole to push off the ground and to assist in maintaining balance. Clinically, it is difficult to isolate the specific actions of single small foot muscles. So, ang titinulong dan no kwan tapnon, digifit tayo ket makagunimit lang nga nasayaat.
So we've come to our last slide. So why legs are such an important part of our body? One, legs are one of the most important part of our body because legs are much stronger than arms. The legs can push roughly 4 times as much weight as the arms can pull. Dancers' main tool for dancing are their legs. Without their legs, they won't be able to perform leg actions that are needed in dancing, especially that ballroom has a lot of leg or foot works. Ballroom dancing will require the dancer to move freely and swiftly using their legs since ballroom is based on walking actions. Second, leg muscles are important to dancers as they must move their feet with precision. In dancing, if dancers would dance a faster beat than normal, they could easily swift movements if they have stronger leg muscles. The gastrocnemius may be considered as the most important muscle among all leg muscles because it causes flexion at the knee to generate large amounts of propulsive force through two joints which can help a dancer to jump, turn, kick and more other routines that the leg would perform. And another muscle is the plantar flexion or plantar at the ankle because it enables dancers to go onto the balls of their feet and toes in pointed shoes. Third, body body is an element in dancing. The body base is a part of the body that supports a dancer to maintain its balanced position. For example, the feet, which is a part of the leg. The leg supports the body for dancers to perform. Fourth, the legs have a better advantage when it comes to endurance. Endurance is the ability of a muscle to exert or remain active for a long period of time. In ballroom, the tempo, energy, pattern, and directions aren't the same. So a dancer needs a strong endurance to be able muscular endurance on their feet to be able to perform and execute a proper dance move. And the the stronger the leg muscle a dancer have, the more they do leg work to strengthen it. Why? Because as I said, ballroom have different tempo, energy, patterns, and directions that needs the legs to be strong. Dancers
need to maintain their legs, so they do exercises and they have what they call leg day workout. This leg day workout is the only day that um they could perform exercises to strengthen their leg muscles. And that would be all.
So again, that's all, guys. I hope you um, know the importance of protecting our legs and knowing the different muscles of leg. That's all. Thank you.